the last part of it is how to help surgeons, not just pre-surgical planning, but intra-op. Sometimes my surgeon asks me in the OR, they call us and say that they could not find something or they have a question, and we are very limited with our imaging solutions in the operating room. So how we are advancing imaging to help the surgeons when we say the field is bloody or messed up field in the surgery. So again, as Dr. Adibo and Dr. Reddy said, I don't have, unfortunately, no financial interest, not as fortunate as Dr. Tandon, but I do collaborate with Ready Minds on imaging solutions. And we all know that 2D screens are workhorse of imaging, and it's a popular YouTube video, just to show to everyone.
Colegas, pida la foto. El paciente, yo creo que tiene algo aquí en la... Lo veo recomendable. ¿Pero qué es esto, hombre? Operar. Mamá, yo lo que llevo la vida donde está ahí.
So the, sorry. So with the advent of three-dimensional imaging, 2D screens become the limiting factor. Significant advances in technology in contemporary times made it possible to create virtual world or enhancing existing real-world objects and scenarios through multiple sensory modes. The medical science has not been able to keep up with the technological advancements, though it's now catching up with the digital divide. So as I think Dr. Tandon's screen was, the picture was much elaborate, but I see as mixed reality as a continuum from real world scenario to virtual world. And augmented reality lies somewhere in the middle, augmenting real world environment with virtual world elements. So coming on to augmented reality. Augmented reality is an interactive experience of a real world environment where objects that reside in the real world are enhanced by computer-generated perceptual information, sometimes across multiple sensory modalities like auditory, haptic, somatosensory, and olfactory. And you all might be aware of these two devices, Google Glass and Microsoft HoloLens, which were head-up displays for augmented reality. So for augmented reality, we have immersive experience, and the AR equipment for that can be attached on the head of the observer, which is called as head-mounted displays, or can be handheld or placed at a distance from the observer with ultimate goal of providing an immersive experience and virtual world objects in the real world. So this is the first head-mounted display, and it was presented at International Status Conference on Virtual and Augmented Reality, Germany, 2002. And nowadays, there's been widespread use of augmented reality in industry. AR has the potential to revolutionize the entire market in every aspect. We definitely see it in education, medicine. This is the defense, and we know about auto targeting. The NASA, you must have heard a few years ago, they sent the Microsoft HoloLens to the International Space Station, and definitely it's revolutionizing the field of manufacturing. And in the medical education, as you can see, this student is one of the application, and the medical student for learning human anatomy, and she can dissect human body into various anatomical layers utilizing AR without need for a cadaver. Also depicting, there she's focusing on the femur, and now she's depicting different kinds of femur fractures. And here they are. So, so without cadaver, it's a multiple use, and application is made without need of a cadaver. Same way, this is, we are collaborating with University of Incarnate Word, and this is my third-year student at Ivy. And we are collaborating for teaching students, medical students, about heart anatomy as well as congenital heart disease. And you can see interacting with the Microsoft HoloLens in the augmented reality, not as fancy as the Microsoft demonstration, but still useful.
Bigger. Smaller. Stop beating. Rotate. Rotate.
So we recently got a grant to expand our work for the medical education. So augmented reality in medicine. Over the last couple of decades, utility of augmented reality has been extensively explored in medicine and especially in assisting medical procedures. There's good publications out there where MRI-guided intervention has been done with augmented reality for CT-guided spinal needle injections, biopsies, oral medicine, dentistry, anatomic pathology, forensic science, and for the, again, simulation for guided procedure for the trainees, as well as the operating room. And this is one of the example of Microsoft HoloLens and a collaboration between Microsoft and Philips, demonstrating the use of AR device in the cardiac catheterization lab, assisting the intervention procedure. So despite these advances, there's not many holistic solutions available in the market for use. And the problem is there are certain challenges. One of the basic challenges that the device should has, or the system should have the ability to being smoothly integrated to the workflow of the intervention without affecting the surgeon's activity during the procedure. Also, there is lack of AR development and application design standards. So there is not a formal standard being laid down for AR applications. So that leads to compatibility issues. Headsets need to be lightweight. Means if a surgeon or a procedure person or physician is wearing the device all the time during the procedure, it has to be lightweight. And again, there is security and privacy issues. I won't go through this messy slides, sorry for too many words, but computer vision is a field of science that focuses on enabling computers to identify and understand objects and people in images and videos. We all have heard about facial recognition softwares. Like other type of artificial intelligence, computer vision seeks to perform and automate tasks that replicate human capabilities. In this case, computer vision seeks to replicate both the way humans see and the way humans make sense of what they see. In today's world, computer vision has been a widespread application in automation industry. You can see the self-driving cars, automated traffic control, intelligence gathering, face recognition softwares, manufacturing, and especially in defense, including target recognition by cruise missiles or drones. Now, computer vision in medicine. So recently, the application of computer vision in medicine has been explored, and large number of studies have been published in the area. A few of the examples are computer vision system for deep learning based detection of patient mobilization in ICU, for melanoma detection, for operating room, computer vision for automated machine learning approach, and computer vision for deep learning techniques for neurodegenerative disease analysis using neuroimaging. And recently, artificial intelligence in pulmonary medicine, computer vision predictive model at COVID-19. So this is one of the example for computer vision in being used in orthopedics.
The new Mako robotic arm-assisted technology enables Dr. Derek Johnson to pinpoint patient-specific implant insertion to within a half a degree prior to even entering the operating room.
We are now using 3D technology with CT imagery, getting a CT of that knee specifically in time, and then placing the implants on specifically on the end of the bone, 3D in space prior to even coming to the OR room or the operating room initially. We then place sensors on the knee itself, allowing the robotic system and software to know where the knee is in space. And then we come in with the robotic arm and make these cuts, but it will only allow me to be locked into a haptic where it will not allow me to cut beyond the bony edges of the bone itself, preserving and protecting the soft tissues of the knee.
So, but there are still many challenges in implementing artificial augmented reality and computer vision in medicine. As Dr. Tandon and Dr. Adipo said, that for any 3D printing or virtual reality or even augmented reality, the building block is the segmentation from 3D images, cross-sectional images. So segmentation of 3D images, it takes time and skills. The second thing is how to register those segmented models onto the patient. So registration of the model onto the patient should be dynamic. So in the OR, it's not, the patient is not stationary. We have to change the position. Also, when we are talking about organs, they are not metals. They conform to the body shape and position. So the model should be able to conform to the body shape and position. The third thing is the tracking of surgical instruments need to be real time. So especially in minimal invasive procedure, if we are going to help the surgeon, the software should have the ability to track the surgical instruments, and that should be in real time. And again, the foremost, the technology should be integrated to the OR workflow without interrupting the surgeon's activity. I'm actually working with the ReadyMinds, and we are working on the solution to navigate these challenges. And the solution for segmentation is AI-assisted auto segmentation, where there should be a platform where you can put the CT images, cross-section images, and you get fast 3D model of the patient organ. And that can be used for 3D printing, can be used for virtual reality or for augmented reality. This is the example of computer vision being used in a kidney surgery, and it's a ReadyMinds model. And computer vision can be used to detect anatomical landmarks. And this is the recent work of ReadyMinds detecting renal artery, renal vein, and spleen. And this real-time ability to detect objects of interest can be used to provide immediate assistance and information to the surgeons. So you can see there, this is the instruments, surgical instruments, and the renal artery, and this is how the computer is recognizing different structures, renal vein, and it's all dynamic registration, and you can see the spleen. As the patient is moving or instruments are moving, this registration also moves. This is another computer vision model, and it can be used to provide real-time analysis of surgical scene. Here is one of the ReadyMinds 2018 model designed to identify surgical tools. And you can see here that as the instruments are moving, the computer is able to identify the scene and the instruments in the scene. And these are the virtual or instrument double created by the computer vision. And this is what the project, comprehensive project, providing real-time guidance to the surgeon and how we are working. So here is the platform which will give us the automated segmented part of the organ in interest. For us, it is, since I'm a pediatric cardiologist, so it's a heart with a congenital heart defect. And then we will use multiple technologies to dynamic registration of this model onto the patient body in the OR. and together it will be displayed on a screen or some type of display modality, which will not interrupt in the surgical workflow. Here's the team which we are working with. Thank you.